Okay, it looks like we've got most everybody. Thank you for joining us today for It's Worth a Shot. Today we are having a partner spotlight and it's concerning care navigation. Next slide, please. As always, when we have a third-party content provider, the information provided does not constitute endorsement or recommendations by Mountain Pacific, but we do like to present outside presenters' topics and views, so that way we can give you a full, well-rounded series where it's not just Mountain Pacific. So again, thank you for joining us. Next slide. So we have some upcoming webinars that we want to highlight for you guys. If you had been on the ANT call this morning, you probably already saw these. But again, we have World Elder Abuse Awareness Day coming up, and the Wyoming Department of Health Aging Division is actually going to be putting on a webinar. It's on June 14th. And you see there's the link. You do not have to register for this webinar. You can just use that link there and then the ID and passcode. We also have a sepsis awareness and prevention webinar coming up. That's on June 20th. And you see the registration link there. Next slide, please. Another one is the CMS proposed rule for 2025. They already had one webinar on this and they're doing another one Thursday the 20th as well. And again, you see the registration. So together with INSPAC, they are going to be reviewing, they're discussing changes that impact your organization by unveiling the changes. They'll discover strategies to adapt and thrive under the new rules. And if you're unfamiliar with the rules, then it's someplace to be able to find them and listen to them. And then also, to be proactive and be aware of them before they go into effect. Next slide. And we have Community Matters, Understanding Social Determinants of Health to Reduce Dementia Risk. And it looks like it's a series. And so as you can see, they got June 26th, July 24th, August 24th, and September 25th. You can go ahead and register for that as well. And you can also see the topics that will be covered under each webinar. So in case you don't want to see the series, you can actually go to ones that are interesting to you or attend the entire series. Next slide, please. So the minimum staffing rule, that's caused a lot of talk and discussion about what's going on. So we did want to support QSource is one of our sister Quinn QIOs, and they have come out with a great resource on the minimum staffing rule guide. So we wanted to publish that for you guys to be able to go see and to look over. And then we also have the new Resident and Family Guide to Understanding Sepsis, and that is a new resource that Mountain Pacific has put out. So we have the link there for that as well. Next slide. So as always, the Mountain Pacific webinars for It's Worth a Shot are recorded and are put on our website. So they're the slides and the recording. We do sometimes have difficulty coming up with ideas of what to present to you guys. So we would like if you could put into chat any topics that you guys are wanting to see or hear about, or any timely things that you would like for us to cover. We always appreciate when we get some guidance from our participants. And we do have a polling question for you, but first I do want to draw your attention to, in the chat, Mary just dropped our evaluation link. That's another place where you can put topic ideas or thoughts about the webinar, and we do review those weekly. So back to our polling question, does your facility provide annual dementia training to staff? And it's just a simple yes or no. With this being, I think it's ABAM. So it's the month to draw awareness to Alzheimer's and dementia and brain-related disorders. So we're trying to cover our bases here. And so we're just curious if your facility provides annual dementia training to staff. All right, you can go ahead and end the poll, Mary. We can publish the results. Look like a majority said yes, and we have a few with no. Okay, I'm going to go ahead and turn it over. We can go to the next slide to Maggie Oakley, who is going to introduce our speaker for today.
Hey everyone, this is Maggie. I'm over here with the Mountain Pacific team in Hawaii, and I am really happy to introduce Bethany Lukens Geiger. PT, DPT, MBA. She is the Vice President of Strategy at Ohana Pacific Health, as well as the Director of Kālele Care Services. Before transitioning out of direct clinical care, she practiced as a physical therapist in multiple pediatric and adult care settings for 7 years and maintains an active physical therapy license in Hawaii. Her background encompasses roles in strategic and program development, project management, legislative advocacy, and analytics in various healthcare settings, population health models, and clinically integrated networks. Bethany graduated with her doctorate in physical therapy from Pacific University in 2013 and her master's in healthcare business administration from Oregon Health Science University in 2020. Bethany, thank you so much for joining us, and we'll let you take us away.
Wonderful. Thanks, Maggie, for the great introduction, and thank you, everybody, for joining. You can go ahead and go to the next slide. So I wanted to just share a little bit about Kālele Care Services, or Kālele Wellness Advocacy, which is really a grassroots community-led model where we primarily use community health workers, or we call them community health navigators, and other licensed clinical staff to really provide a trusted resource for the community. As we've all experienced, healthcare can be a very confusing landscape, especially for our kapuna or elderly in our population, especially when they're transitioning between multiple care settings. And so we actually started this grant-funded program. It is initially grant-funded through next year, May of 2025, on both Maui and Kauai, to provide transitions of care support, help with some goal development and attainment, support patients and their caregivers in reconnecting with primary care. We also do home readiness assessments. So when patients are still in the facility, we actually send our navigators out to the patient's home with a designee of their choice to do a home safety assessment. And then that information can be reported back to the clinical team so that they can better simulate the patient's home environment before they get there. We've had a lot of success and good results with that, or a lot of appreciation, particularly from the rehab teams at the facilities. We also concentrate on health education, chronic condition management. We provide medication reconciliation and that chronic condition management with our APRN, social services assistance, and then social support and advocacy. Next slide, please, Maggie. So the high-level model that we are currently implementing is primarily navigating patients that, again, are going through multiple care settings. So they're going from an inpatient hospitalization to a short-term rehab stay at a SNF, and then back home to the community or to another care setting. So the way that our model works right now is the navigator engages the assigned patient at inpatient bedside and really helps them prepare for admission to the skilled nursing facility. We have seen an impact on the number of patients that we're leaving against medical advice, just because they have that continuity of that navigator supporting them while they're inpatient and really preparing them for what does a SNF mean and what does it mean to go to short-term rehab and what are the facilities like, what should they pack to bring with them, what their expectations should be. And so once the patient officially gets admitted to the skilled nursing facility, that's normally when the patient signs consent for our program. And then that navigator and our clinical team continues to support the patient in the SNF and helps the patient and caregiver prepare for home or the next level of care. So one of the things that's been really valuable about the program and has been really rewarding for me and our team is just that integration with the skilled nursing facility staff, because Kālele is part of Ohana Pacific Health, which is one of the biggest post-acute care providers in the state. So we're really able to integrate with the social services team and the nursing team and the administrators at the nursing facility in order to help with that continuity of care. The navigator then supports the patient in the community post-discharge and continues weekly meetings with the patient up to 60 days post-discharge to work on goals. When we're doing that, you know, if the patient is meeting all of their goals or they don't need a lot of assistance, we do discharge them early so that we can then pick up another patient that might need a little bit more assistance. I did mention that we have an APRN that provides education and support primarily for ambulatory care sensitive conditions like congestive heart failure, diabetes, COPD, et cetera, and also provides medication reconciliation if that's not already done within 3 days of discharge from the skilled nursing facility by a home health personnel or the patient's primary care provider. As many of you know, access is a big issue, particularly in Hawaii, but definitely across the nation as well. And so sometimes those patients that are discharging from a facility cannot see their primary care provider in a timely manner after discharge. So the medication reconciliation and support for chronic conditions has been really helpful. And we do plan to hopefully expand our program to kind of serve as a PCP bridge as well, so that those patients can see our APRN in the interim when they're waiting to get into their PCP, with the intention of always handing that care back over to the PCP with a warm handoff. Next slide, please. So really what we're expecting as far as our impact, and I do have some data on here from our actual impact, is reduction in 30-day all-cause readmissions. So the data for our baseline from Halemakua, which is on Maui, our skilled nursing facility on Maui, was about a 13% readmission within 30 days of discharge from the hospital. For those patients enrolled in our program, it's currently at 2.9%. So we've seen a really big reduction in 30-day all-cause readmissions. The 13.1% is just looking at the Medicare population, so that's just a little caveat with the data just that we have access to. But we definitely have seen a reduction in 30-day readmissions within our program, supporting primarily Medicare and Medicare Advantage patients, but also some commercial patients. One of the other plans outside of Medicare had an initial baseline readmission from SNF at 8.6%, I think. So even though that's a little bit lower than the initial baseline for Medicare, we're still seeing a decrease in readmissions for those patients that are enrolled in our program. One of the things that I think my team and I are most proud of is just the patient experience of care. So again, you know, if any of you have gone through the healthcare system yourself, or you've had parents or aunties or uncles that have gone through other family members, it can be really confusing, and you know, different agencies that I've talked to have gotten feedback that, oh, we just feel like we got a discharge paperwork and got dumped and didn't really know what to do. And so by having that same person follow the patient and their caregivers throughout multiple care settings along the continuum, it's resulted in a really good patient experience of care. And we have 10 out of 10 people that have been through the program that would recommend it to family or friends. So a really, really high net promoter score. We also, you know, aim to improve the health of populations, primarily by addressing social determinants of health, managing expectations, improving health literacy, autonomy, and access. And so really trying to connect patients and their caregivers with community resources that they may not know are available to them, or that may just be kind of tedious to get set up. So we work really closely with other agencies and the county offices on aging to ensure that patients get the support that they need when we identify those needs through our conversations with them and the social determinant of health screening. We also aim to reduce inpatient length of stay by assisting patients with inpatient discharge and the SNF admission process, and then preparing patients for SNF and managing patient caregiver expectations. Like I mentioned, I'm reducing that leaving against medical advice. And I do apologize that this slide is a little cut off. I used too much of my margins, but you can go ahead to the next slide, Maggie. We also aim to reduce skilled nursing facility length of stay. So this happens by us, you know, integrating with the SNF staff and preparing patients and caregivers for home or the next level of care, and providing added support for patients post-discharge. We have had a lot of feedback from the SNF staff that You know, they feel a little bit more comfortable sending patients home that are medically ready to go home, that, you know, it is technically a safe discharge, but they just feel a little bit nervous about it, just because of the lack of support maybe that a patient has in the community. And so knowing that our team is going to be following up with them and actually going to their home and laying eyes on them and helping them in their next community environment has added a lot of confidence to some of those more questionable discharges. We also want to reduce inappropriate emergency department utilization and inpatient utilization. So we do a lot of education on care options and what the right care is at the right time, at the right place. Our clinical staff also helps the community health navigators with that in our case reviews. If there's somebody that's struggling with something, then they can offer that clinical advice on maybe what their next step should be to get care. And then reduce medication errors. So we all know that has a big impact, particularly on readmissions, and just especially when people have gotten a medication list from the hospital and maybe a slightly different one from the skilled nursing facility, and then they get home and they have their medications there, really making sure that patients are understanding what it is that they need to be taking and when. And we do a lot of support with that, both with our APRN and our navigators in helping to organize medications and ensuring that people understand the instructions. Next slide, please. So I was asked by the Mountain Pacific team to really share best practices that we've learned, as well as some challenges. And so I think one of the things that really stands out to me for best practices, that I feel really grateful for this program, and you know, it helps that we are grant funded initially, because we can kind of build it how we want. And not really be kind of pigeonholed into different payer programs, or whether that's CMS programs or other local payer programs. And so we're really able to keep the patient's goals and needs central, and we really do concentrate on that patient education and empowerment, so that the patient is learning more self-efficacy and their caregivers are being involved in their care. And so really looking at those comprehensive assessments with a focus on social determinants of health and the things that occur outside of typical medical environments, and really building that trust with clients and that humanity in care delivery. So one of the things that's been really rewarding is just seeing, we have some patients, actually the guy in this picture, who I have a video that I can share with the group if we don't have time to watch it, but he was one of our patients, and you can see our navigator, Jody, there on the right. And he was, you know, known by his insurance provider and their case management team, but they really could never get a hold of him, and he would never allow them into his home. And they had been watching him because he was a high utilizer for over a year. He developed a really close relationship with Jody, our navigator, and he invited him into her home on a weekly basis. She was able to help him with all sorts of things that he needed in the community to keep him, to really break that cycle of him going back to the hospital. He is a gentleman that's blind and has had uncontrolled diabetes, had an amputation due to that, and lived alone really without any caregiver support. And so we were really able to make a difference in his life and just his stability within the community, and allowing him to access resources that were available. One of the things, just as far as using non-clinical folks, that I'll talk about as far as best practices, are really ensuring that when you're building these programs, you're reducing unnecessary documentation and processes, and ensuring that your team really understands why. As we know, there's a lot of regulatory things that need to be done, and compliance things that need to be done when you're, managing people's care in any way. And so just trying to keep things as non-administratively burdensome as possible has been a big goal for us. Resources are constantly changing. There's really good websites, that are available, like findhelp.org, et cetera, but really ensuring that you're aware of the resources in your community, and partnering closely with, the County Office on Aging or other hubs that, kind of manage a lot of the resources, or aware of the resources. So really, building those relationships and those forms of effective communication with community partnerships has been really helpful as well. I already talked about medication reconciliation, really that building trust within the interdisciplinary team, and and ensuring that there's the case review and clinical oversight, documentation of key metrics. That kind of relates to, the keeping processes clear and reducing unnecessary documentation. There's definitely things that are really important for us to show the value of our program, that we, try to instill the why behind, why we're having those processes and why we have to record these things. And then sharing success stories. I think that's really important, both internally with the team and the community, because you can really see the impact beyond what you're going to see in the data. And then the last one there is collaborative care planning with external agencies. So making sure that we're communicating and that we are working together and not duplicating services when there might be some overlap and some support. Next slide, please. Some of the challenges that our team identified with staffing, I think that that's a struggle kind of across healthcare and across a lot of different industries right now, particularly in Hawaii on the neighbor islands. It can be difficult to find staff just because the job markets aren't strong in general. And then supporting a team across multiple islands. I mentioned we do have operations right now on Maui and Kauai. So there's some challenges in just ensuring that our team is integrated, that we know each other, that we trust each other, that we can support each other, even though we're working in different environments and have to get on planes to go visit or see each other in person. Funding is a big challenge. A lot of the services that we're providing are not typically covered by typical insurance. And so really looking at alternative payment models. I did mention we're grant funded right now, but really kind of exploring those other models that can allow us to be a little bit more flexible with supporting patients, given the impact that we have on total cost of care and patient experience, particularly related to reducing readmissions. Time management, these navigators are out in the field, they're driving all over, they're seeing patients in their home, they're seeing patients in the skilled nursing facility, in the hospital, they're coordinating with community agencies. And so hiring a team that has strong time management skills and then ensuring that we're building processes for them, that it allows them to be more successful in that time management. Data, I'm sure you guys all feel the pain of data integration. We're currently kind of exploring how we want to move forward with what EMR we use as we expand and what access to different data we can have in the effort to ensure that continuity of care and that communication across various care settings. There's just a lot of different processes. I think, one facility does things one way and another facility does things another way, even inside the same system. And so ensuring that you're kind of coming up with your baseline process and trying not to veer from that as much as possible, but then also being agile and flexible to meet the needs of your partners. Again, with community health navigators or workers in particular, a lot of them have different backgrounds and various levels of experience. And so ensuring that we have that comprehensive training to kind of get everybody to the same baseline or close to that. We do have challenges with lack of or delayed access to community resources. So again, really kind of understanding what's out there, understanding the resources that are changing, and building those partnerships so that you can stay abreast of that has been a challenge, but can be really important in the success of a program. Communication barriers, so, faxing versus calling versus inpatient meetings in these siloed and fragmented systems can be difficult to ensure that everybody's on the same page and coordinating to provide care. Obviously, there's some various levels of client and caregiver cooperation and engagement. So we really do try to focus on building those relationships and that engagement so that we're, teaching people how to fish versus fishing for them and ensuring that they can kind of navigate their own journey after they're no longer in our program. We have gotten a lot of feedback from our clients or patients that have gone through the program about that, the navigator and the team didn't only help me while I was enrolled, but they gave me the skills and the resources to be able to, get things for myself or advocate for myself once I graduated. And then provider engagement and communication. So particularly, with PCPs that are really tasked with managing the patients that are attributed to them or that are on their panel, ensuring that we are working closely with them as much as possible to kind of provide an adjunct or a support to them to make their lives easier, to help them manage their patients, but still always have them maintain that kind of control or that management over those patients. So you can go to the next slide. In the interest of time, I know we only have a few minutes left. I will send this out if it hasn't been sent out already, but there are some links both to Ohana Pacific Health and the Kālele webpage, as well as a testimonial from the man that was in that picture a couple of slides back and his experience in the program. But I did want to open it up for any questions and see if anybody had any feedback or comments, questions. I'm happy to answer what I can.
Feel free to come off mute if you have any questions for Bethany, or you can type something in chat.
Oh, thanks for sharing the website and the link to the video, Miranda. I appreciate it. Okay, well, if there are no questions, again, I really appreciate the opportunity to come and present on our program. I'm happy to answer any questions that anyone has at a different time as well. You can definitely feel free to email or call me. I'm happy to share our experience and our challenges and success stories as well.
Sorry, Bethany, I was talking on mute. I wanted to say thank you very much for your presentation. We really appreciate the program that you guys are starting. And I can just, I hope you guys get the funding, because the growth and the implementation of that in other areas, especially like in Alaska, would be wonderful. Because I'm sure there are some kind of questionable, not questionable, but, uncomfortable discharges that happen, especially with the small amount of beds and things like that. So hope you guys get to advance that work. So I just want to thank you guys again for joining us on this week's It's Worth a Shot. Next week, we will be going over the review of the quality measurement reports that we sent out and some information about quality measures. So we hope you can join us next Wednesday. Our very own Tom Vincent will be presenting, and we will hope you guys have a good Wednesday, and thank you again.
Thank you. Bye.